Hey, welcome back to another episode of the Red Pill versus Blue Pill. My name is Dr. DeLon Canterbury, and I'm here today to show you more about amazing ways that you can use deep prescribing to help leverage and grow your current practice. So, again, I am DeLon, the Chief Deep Prescriber, founder of Geriatrics, as well as founder of the Deprescribing Accelerator. I hope you guys are doing well. And so today we're going to talk more and dive more into really why I'm here in front of you. We're going to talk about why I decided to create the Deprescribing Accelerator. We're going to dive into really what the program promise is, what we plan on delivering for people who leave our cohort well equipped to manage and handle deprescribing in seniors, and then really kind of highlight who this program is meant for and who it's not for. So we're going to dive on in and let's start with some of the basics, okay? Really, my goal is to not only keep and maintain this movement of amazing pioneers in senior care, but literally showing people that you can leverage and monetize deprescribing with a number of models to explore. So I don't care if you're a nurse, a pharmacist, an entrepreneur in healthcare, a senior care wellness director, you all have something to take away in how you can leverage and use deep prescribing to improve those value-based metrics that these insurers are reimbursing for. So let's talk about this. I started my company with geriatrics 2 years ago, seeing the need for having more integrative pharmacists in these senior care organizations, nursing homes, adult daycare centers, SNFs, independent living communities. They all need an advocate when it comes to stopping over medicating. And unfortunately, I found that a lot of our seniors were the ones who are struggling with polypharmacy and prescribing cascades. And honestly, numerous medications that just don't even need to be used anymore. And we literally have to have a shift in our medication mindset for our patients to get the best out of their care. So I felt, let's make this easy. Let's make this practical. So I'm not just telling people what to do in theory, but giving people tangible steps to use deep prescribing to grow their business. Now, again, this could be done particularly for our seniors, but you could easily just be a therapist who wants an added value added service. You could be a gerontologist who would like to have a little more comfort in knowing some of these meds and how to refer out if need be, or work with a pharmacist to de-prescribe. But again, the potential is just endless. And so I want people to take away not just all the brainy, sciencey, clinical geriatric pharmacist stuff, but I want you to also get into this mindset shift on how this can grow your business, how you can develop deep prescribing workshops for your communities or your patients, or really summits, conferences. There are tons of ways you can leverage deep prescribing. So my goal and what you will leave with is understanding clinical, easily applicable tools that you can put into use today into your practice to, again, stop harmful medications in our seniors. Simple. We're stopping harmful medications in seniors. We're reducing high risk meds that lead to those unfortunate outcomes like adverse events, falls, confusion, you name it. But the goal is to give people the clues and keys to using this value added set of services as a way to 10x your business and grow your business. So, what I've noticed is that, yeah, pharmacists are the damn best at de-prescribing and managing meds, but our providers need all the help that they can get. And so a perfect way to segue your model into integrating with more outpatient clinics and prescribers is to work as a team and show them that we can come with this olive branch, with this way of reducing unnecessary harm, or, hopefully avoiding them wasting time with repeated clinical visits and repeat medical visits just because, again, the meds have not been optimized, or there hasn't been a fine-tuned lens on ways for opportunities to de-prescribe. So medical providers and all the support they can get. So this is going to end up helping those providers who are in this space who may not be as comfortable with the world of deprescribing. Hey, that's what pharmacists do. And this is a program led by a pharmacist, so you will get pharmacist-based, evidence-based recommendations on how to implement this. So again, all for your benefit that you can use today, not fairy tale, not for practice, but literally today. And so I created this for others who, in my line of work, I've had my share of senior patients as a geriatric pharmacist, but this is again meant to teach others who may not be as savvy or just simply want a refresher on how you can use this, get comfortable with deprescribing in our seniors, but more importantly, leverage that as a way to grow and expand upon your business, whether it's you as a pharmacist, maybe contracting with an outpatient setting, or you as a nurse being consulted on how to implement and change protocols for deprescribing within your nursing home or any other clinic or any other patient setting. So the opportunity is yours, honestly. Endless. So who is this program for? I am looking for like-minded, progressive thinking pioneers in healthcare, particularly those who are facing senior patients, but the skill set you will gain can be used in a number of demographics. We are looking for nurses, pharmacists, social workers, prescribers, so PAs as well, NPs, those who literally are touching senior care lives. And if they're able to touch these lives, even if you're an OT, PT, speech therapist, they all have a role in deprescribing. And that's the beauty of this program, is we are looking to empower senior care organizations. We're looking to empower those clinicians who are here and ready to develop a new service and want to provide a sustainable value-based service that, again, you can leverage and use to grow your revenue. So this is not meant for patients, okay? This is not meant for the general public who doesn't really have a strong grasp of, per se, what the medications may be doing, or even really knowing how to navigate the healthcare system. The content that they'll learn will help advocate them, but this is, again, meant for the clinicians. So again, like-minded nurses, pharmacists, caregiver advocates, and possibly caregiver referral sources can benefit from this program, but this is meant for clinicians who have an interest in stopping harmful meds, okay? This is not going to be meant for those who don't care about their senior patients, okay? This is not meant for people who don't want to think out of the box, who aren't comfortable taking that leap into the unknown or changing their mindset around how you can conduct business with deprescribing. Look, reimbursements will always be there, but my goal is to show you that there's a model that you can take without relying on the insurance reimbursements. We will show you cash-based models that you can consider using and leveraging, again, to help with your practice. We are looking for people who care extensively about stopping preventable harm and reducing risk in seniors. Those are who will benefit the most from this program, especially those who may already have a practice or a nonprofit, or already are in the mindset of developing their own type of new service or new, for instance, pharmacy service that could be offered for deprescribing. Yeah, you can do this in a community setting, okay? You can. Don't think that it's a myth that you have to rely on that copay. There are ways you can monetize services in this setting that you may not have to require a script, right? So we mentioned who this program is for. Again, this is not for patients. This is not for caregivers. This is more for the advocates, the clinicians who touch these senior patients, all right? What happens when someone joins? So there are, again, when people join, there is a movement, a community of like-minded, again, deprescribers. So you'll be a part of our deprescribing army. We have ongoing cohorts, and so people will be a part of this family indefinitely in our private LinkedIn group. We also have 10 weekly live trainings that you will be a part of on how you can leverage and turn deprescribing, again, as a service that you can provide. Patients will also get monthly Q&A calls with yours truly. So Coach DeLon, Coach Morpheus, I'll also be there not only showing you and coaching you through some of the clinical pieces of Deprescribing, but we'll also dive into how you can leverage that, monetize that, how you can package your service, how you can develop your signature service for your program, and use that again as a means to help our seniors who are out there struggling with these meds. You'll also have access and where we will develop a specialized 2-hour VIP road mapping session with you. So you and I will have a 2-hour roadmap. You and I will essentially talk through a sustainable Deprescribing plan that you could use for your business. Many avenues you can take with that. Could be developing your own group or consortium to teach other clinicians. It could be simply using a conference or a summit to empower our communities, right? It could be as simple as creating your own one-on-one Deprescribing service. You can honestly name however you want to monetize and use it. But it's more than that. We talk about grant opportunities. We talk about potential strategic partnerships you can make, funding that you can get with the right partnerships, right? So what else is included? You're also going to get access to our Deprescribing Toolkit. So that is actually a nice, pretty easy to use PDF that gives you all the clinical tools that I implement when it comes to Deprescribing opportunities and educating providers on Deprescribing opportunities. You will also get, in the future, it's still pending, so this is still in the works, so maybe I'll save that for later, but we will be CE accredited in the future, so hold your breath. We're still pending on that for now, but that is going to happen. I'm not sure how soon, maybe in the fall, but we do plan on having this CE accredited for pharmacists, nurses, social workers, and prescribers as well. So when that day comes, boom, we'll be able to throw that certificate and you can knock out your CEs, okay? Lastly, there is a certificate of achievement. So people who complete this program will become certified Deprescribing advocates or certified Deprescribers by yours truly. So we will have that customized and made just for you after completing our program. Of course, with our trainings, they're going to be 10 live weekly trainings. There will be pretty much monthly to bi-weekly Q&A calls. So if there's any questions about the content or again, how to monetize and leverage the business model with Deprescribing, that's what our coaching sessions will entail. And in addition to that, you will also get a little bit of a cheat sheet that I have for knocking out some of those patient assessments that I use pretty frequently in clinic, okay? You'll have access to a year, or about a year, of all the content in our private Kajabi portal. So you'll be able to go back, watch the cohort's past lectures as much as you need. If you want to have that community, you're going to have other like-minded Deprescribers in our private group where you can share your wins, ask your questions, talk through any barriers that may come up, and of course, just ask any questions that you personally have about our course content, okay? So what else is included? Man, what else? Trying to think what else you get. I mean, apart from our dope community of movers and shakers after our first pilot, honestly, success comes to those who truly do the work without delay. They trust the process. They believe that they can implement sustainable change with Deprescribing. And you got to put in a little bit of the legwork. Don't get me wrong. We're going against the grain of a system that completely doesn't want us to exist. And I've accepted that. That's fine. But we know in our hearts, our job is to get our patients off of these meds that aren't necessary. And we know overprescribing is an issue. So success runs with the person who is fearless, who does without delay, who learns how to lean in and trust the process, ask questions along the way to help you fine tune that type of high ticket service that you're trying to provide. And again, create a sustainable impact for those who most need this level of advocacy. So the success really comes from your heart. Do you care? Are you willing to put in the work? And are you willing to advocate for those who, again, don't have that voice? So that's essentially what it looks like. We have about 5 to 7 people in each cohort. Again, it'll be about an hour and a half long for each live training, accompanied with self-paced modules where you'll also be able to complete those modules at your own pace. And that will generally take about another hour. Okay. So about 2.5 to 3 hours required per week for you to commit to, for you to actually learn and implement and then start using those tools today for your practice. So we look at about 5 to 7 people. We are closing our applications actually pretty soon, Friday. So May 27th will be the last day for people to apply. Right now, we only have 3 seats left. So 3 are remaining, 333. We're tentatively going to be starting June 3rd. Not sure which date. We usually, it depends on the group. That's the best time for us to meet. And so we'll assess that once we close our doors and have everyone's buy-in for the perfect schedule. So again, you will have a group of 5 to 7 amazing Deprescribing advocates. Try to keep it close-knit so that we all can learn as best from each other and maximize our time together. And our program, for those interested, this is an investment for how you can better yourself. And so investing in this is the next step to really leveling up your business and giving you a different perspective on how to monetize value-based care, which is what we all should be doing anyway. So hope today was helpful. Really what we're doing is showing you how you can leverage Deprescribing and change your senior care organization or clinic or nursing facility, whatever the case may be, for the better by just making a few tweaks and what you will take away from this amazing program. So tons more to go. Hope today was a nice rundown of what you would expect. There are 10 topics that we cover in our course, but really there are about 4 main phases that you will end up going through. The first phase is understanding the need for Deprescribing, of course, in our seniors. The second place is using and leveraging clinical tools that you can put into practice today to help with those seniors and Deprescribing. Third phase is actually developing potential revenue streams or exploring different revenue streams using Deprescribing as a value-added service. And then lastly, the final stage is developing a sustainable patient advocacy and empowerment route so you are leaving with a lasting impact of service, which is ultimately why I started this program. It is to serve our seniors and serve our clinicians who are already inundated with a broken healthcare system and want a different way of providing that value-based care. So with those 4 stages, you're going to leave knowing how to stop and spot harmful meds to seniors. You're going to know potential revenue generating streams and how you can leverage Deprescribing. And hopefully you'll leave with the warm fuzzies that you're going to be a Deprescribing advocate, and that can translate to more patients who want to work with you because of that level of care you're giving. So hope today was a good rundown of what all is jam-packed and included. Of course, we will be CE accredited in the future. I can't say that just yet. So this next cohort likely will not get CE accreditation, but I'm also hearing that some will allow retroactive CE. So let me investigate that before I tell y'all some wrong info. But hope today was helpful. Let me know what stands out to you, what resonates. Again, this is Dr. DeLon Canterbury. Love to be of support and look forward to seeing you in our Deprescribing movement. Have an amazing day, okay? Take care.